I do a lot of hiking. I like to run. I've always liked running ever since I was a kid. Recently I've been doing triathlons and have just climbed my first mountain, Mount Whitney.
Just a few weeks ago, those accomplishments seemed insurmountable for 26-year-old Rob Church. That's when his dreams and training were abruptly put on hold.
I woke up one morning after having a persistent cough for about a month and a half and woke up feeling like I got hit by a truck.
Physicians in his Orange County Health Network told Rob he had a malignant tumor on his left lung and the lung would have to be removed. Crushed and distraught, he turned to Scripps Memorial Hospital Encinitas for a second opinion.
The problem is that Rob is such an active kid. It was one of those things where I was like, this is really going to change this kid's life if he doesn't have the ability to do the things he really likes to do.
The team at Scripps Encinitas, led by renowned pulmonologist Dr. Samir Makhani, was confident Rob's tumor could be removed with less invasive surgery. With the help of philanthropy, the hospital was prepared to treat Rob using state-of-the-art technology, a kind of GPS system that detects and eliminates tumors using sophisticated scopes and lasers inserted through the mouth.
We were able to isolate and remove the entire tumor itself without disturbing the underlying architecture to the lung. And so we saved his entire lung on that side.
I woke up to the news, my dad told me that it was gone and it was out. And that was probably one of the best feelings I've ever had in my entire life.
A few weeks later, Rob was living his dream.
Since then, I've summited Mount Whitney, the tallest peak in the contiguous U.S., and done my first half Ironman.
For our team, it makes us feel really special that we were able to help him get back to where he wanted to be.
Scripps Encinitas and its highly trained team are at the forefront of new approaches to medical care and surgeries like Rob's.
We're seeing everything move to a more minimally invasive fashion, and that requires new technology, it requires innovation, it requires equipment, and that all comes through philanthropy.
Advanced surgical programs are putting Scripps Encinitas on the map as a regional center for innovation.
We're going to move one day to where we're going to be treating cancers from the inside and not having to do any type of open surgery. And here with philanthropy, we see that as our vision.
It is community support through philanthropy that helps make innovative care possible for so many more patients like Rob.
What stood out to me about Scripps Encinitas was the level of professionalism that they exhibited, the kindness that everybody had.
I'm hoping we're going to see him on the Ironman one day in Hawaii and raising his arms up as he crosses that finish line.